Hi, everyone. We'll get started in about a minute as people can join. My name is Farhan Banji. I am a professor of pediatrics and critical care at the Montreal Children's Hospital. I'm really excited today to present to you our panelists that are going to talk to you about cardiac arrest in children and what that means and how we can move forward. So we are extremely fortunate to have three amazing panelists with us today with very different perspectives. The first one of our panelists is Mrs. Rose. Rose is the mother of a young boy, Jacob Dawes, who had a cardiac arrest at the age of 15. So she knows firsthand what it means to go through that as a parent. And she's going to help us understand what that scenario was like and has really thought about what we can do to make that process better and how we can engage the community to do that. Our next panelist is Dr. Ellen Khalil. Dr. Khalil is a pediatric emergency medicine physician at the Children's Hospital, was the former program director, and now is actually the director of education for the entire McGill University healthcare system, a real expert in resuscitation and in disaster planning, so somebody that we're very fortunate to have. And then our third panelist is Christina Skiadopoulos, who is a pediatric intensive care nurse and also happens to be in a master's program in nursing to become a nurse practitioner. She is one of the leads for our McGill student-led World Restart a Heart activity. So the real pleasure to have her here as both an expert in pediatric resuscitation, critical care, as well as a lead to the World Restart a Heart campaign, which we'll get to hear about more from her. So I'm super excited to listen to our three panelists speak, and I'm sure that you are as well. So without further ado, we'll get started. I'll start with Rose, and what I'm going to ask her is to help us understand what the parent experience was of having a child that had a cardiac arrest. This is something that those of us who are parents we can't even imagine what it feels like to go through that, and to perhaps give us a sense of what yourself, your husband, your family were going through there, and what it meant to you, what you were thinking about that whole time. I think that would be really valuable for our audience if you can frame things for us.
Okay, well, thank you for having me and letting me speak about this. So I actually wasn't there when Jacob fell. My husband was, so I'm recounting what his experience was. And in all honesty, as it happened, they didn't know at first what was happening, right? Like it was during a play, and the play kind of went off, and Jacob just fell. But my husband did notice that he didn't fall normal. Like when somebody normally falls, they put their hands out or they try to stop the fall, and Jacob didn't. He just smashed down to the ice. And so he right away was like, that's Jacob, something's wrong. So he got around, and people were telling obviously everybody to stop the play. And his coaches were the first ones to go see, and they could tell that something was wrong, but nobody at this point really knew what it was. And I think that's also part of the scary part, is nobody knows what's actually happening. We were lucky in our scenario that there was a retired nurse, a mom on our hockey team who's a retired nurse, and her too realized that his fall wasn't normal. So she came around, and I think she realized very quickly what the situation was. So she started CPR pretty much immediately as soon as she got there. So what the delay was exactly from when he fell to when she started the CPR, I honestly, I don't know, because I wasn't physically there at that time. But she started compressions right away. Somebody who was there had their wits about them to go get the AED. And we were also very fortunate that there was an off-duty police officer, also a mother on the team, who had just finished training in her job on how to use an AED. So when they brought it, she knew exactly what to do, right? She opened it up. There wasn't any thinking. She knew exactly where to put the pads and press the button. And so he received 2 shocks from the machine. So all this happened when I was driving driving to the arena because somebody called me and said that something had happened and that they had called for help, but that was the only information I had at that time. So we didn't actually know it was a cardiac arrest until we got to the hospital. That's when we first were told, you know, he's had a cardiac arrest. In all honesty, before that, we thought it was an epileptic seizure because his grandfather has epilepsy. So that's what we were thinking, that it was epilepsy. And that's, I guess, also the scary thing is the not knowing what to look for, to know that that's what was happening, right? And so everybody knew something was wrong, but not exactly knowing what was happening. So it was when we got to the children's and they did their assessment that we realized, and they told us that it was not an epileptic seizure, that it was actually a cardiac arrest. So I'm not sure if you want more details on exactly what happened, or I mean,
yeah, perhaps walk people through what you and your husband were feeling, you know, what he was going through, what you were going through, and how, you know, what was going through your mind at that time as parents.
Yeah, so it's interesting. So for my husband, actually, you know, when he recounts it, because he saw it all. Unfortunately for him, he actually saw it all, and it is pretty traumatic because, I mean, Jacob did go kind of like a gray color. It's like an odd bluish gray, I guess, color, and you know, he took his last kind of gasping breath, and so he saw all that, and I think it's a mix of shock, just not being able to process what you're seeing, especially that it's your own child, and sheer desperation because you just don't know what to do. Like, had we not been there with people who knew what to do at that time without being trained for CPR, really, we wouldn't have known what to do. We really wouldn't have known how to handle it, and I definitely wouldn't have had my wits about me to go get an AED. And then for me, I showed up to a sea of lights because there was a fire truck and ambulance and 2 police cars, and my kid being put on a stretcher and taken away in an ambulance. And then somebody just told me he's okay. We got his heart started again. And I was just like, what? I don't understand. His heart stopped. And so, you know, you're trying to process how, why, I didn't understand. I couldn't process what I was being told. It's actually kind of weird, a weird feeling, because I couldn't understand. I mean, I understood the words, the English words being said, but I couldn't process what was being said. And even when the doctors started telling us, when they had put him in an induced coma and he was in the ICU, and the doctor was telling us, because at first what they said was it's hour by hour. We don't know. We don't know. His lungs are in really bad shape because Jacob also aspirated vomit. And so they told us it's hour by hour. We don't know right now. So that's not anything any parent wants to hear. I couldn't process it, what was being said.
I can't even imagine what that scenario is like, and thank you for being able to share that with us so that we get that feeling and understand, you know, what our parents and families go through. We've talked about this statistic before, and we know that, you know, less than 10% of people that have a cardiac arrest outside of hospitals in Canada survive. And you know, knowing that, and knowing, you know, the impact of CPR and defibrillation, which Christina is going to talk to us about more, what advice do you have for sports organizations, schools, coaches, parents, um, you know, bigger organizations in terms of CPR awareness, AED use, training? But do you have any advice for us as a healthcare community and the public to help us think about this?
Well, definitely, you know, train. Like, you know, we when right after all this happened, obviously when the dust kind of settled a bit, we went and we did our training as a family. Even our little one, who's 10, got the training. the entire hockey team. I mean, everybody really had the same feeling of, oh my goodness, if Denise hadn't been there knowing how to do CPR, I don't think I would have been able, like everybody had that same, I don't think I would have been able to do, I wouldn't have known what to do, I wouldn't have known what the signs were. And there's also that point of time where you kind of question yourself, like, is this actually serious? Is this happening? What's going on, right? So I think that just training, and not just training once, because for those of you who've done a CPR training before, it's a lot of information to take in for people who are not medical professionals. Like, it really is a tremendous, because it's usually also combined with first aid. So it's a lot of information to take in, and most of us won't remember all of that. So I think that redoing it is really important, doing it regularly, maybe every year. I think having takeaway material would be nice. Like when I did mine, there was no takeaway material that I could go read after. So that would be great. And, in terms of the AEDs, I mean, if there could be more AEDs around, and not just around, but maintained. There's been a couple of instances where I've been in public organizations and realized that the AEDs were in locked spaces, which means it's not available, really. If it's locked, then somebody has to find somebody with a key. So it's not available. I've been in instances where the AEDs didn't have the proper equipment with them. So something to shave a chest, if it's, somebody with a hairy chest, a towel, batteries that aren't expired. So all of this is, really important. And I know that there's a cost attached to it, but the cost really isn't that astronomical that it's something that we shouldn't be doing. Like, I think it's important that, not just the training, but that the AEDs are available and maintained properly.
Thank you so much for sharing that with us, Rose. I think that is so valuable. And, as one of our colleagues, as Patricia, who's a cardiac arrest survivor, has taught us, she says, I was lucky to survive. And I think that's the same thing in Jacob's case. And then what she's always said is, there he is. Hi, do you want to say a word?
Camera, but
do you want to say a word?
Thank you.
Thank you very much for everything.
Yeah.
Thank you. Thanks for dropping by. What she said is, it's not right that luck determines that. We need to be better as a system so that we're prepared and that luck doesn't come into this. So you can all see Jacob there and see how amazing this was, and this is why we're talking to you about this. We're going to move on now to Christina, who's going to help us understand a little bit about World Restart a Heart. This is an initiative that it's a global initiative, but it's something that our students at McGill, our health sciences students, have taken on. They trained a whole bunch of other students at McGill last year live in their classrooms, and this year they've moved to a virtual platform because of the pandemic. It's absolutely incredible what they did last year, and they trained more on that World Restart a Heart Day than anybody in the country of Canada. This year, it's even bigger and more impactful. It's a wonderful activity that they've done. So I'm going to ask Christina to talk to us about that a little bit. For those of you in the audience, as you start to think of your questions, we can save them for the end, or there's a chat box where you can start to insert questions and we can take them together and give them to the appropriate panelists to answer. Feel free to enter them at any time. I'll turn over to Christina. Christina, can you walk us through World Restart a Heart, how it relates to McGill and Montreal, and what we're trying to do?
Yes. So hi, everyone. Thank you, Farhan, for the introduction. Essentially, I'm part of a group of students from McGill University that have come together from different programs within the Faculty of Medicine. So nursing, medicine, speech language therapy, physiotherapy, occupational therapy, and we've teamed up with some physicians from the MUHC, two of them being here today, so Dr. Khalil and Dr. Banji, as well as some representatives from McGill University and the Heart and Stroke Foundation. And we also have a member on our steering committee who is a study in cardiac arrest survivor that Dr. Banji mentioned, Patricia Gellis, and she's got quite an incredible story as well. So together, our goal is to really raise public awareness and to teach people on the importance of bystander CPR, ultimately increasing the rates of bystander CPR, or sorry, bystander resuscitation, because it's more than just CPR. And we hope to do this through our campaign, which we call World Restart a Heart. Afin de vous donner une idée, environ 35 000 arrêts cardiaques surviennent au Canada à chaque année et la plupart d'entre eux surviennent à la maison ou dans des endroits publics. D'ailleurs, les données démontrent que plus que la moitié des arrêts cardiaques se produisent en présence d'un membre de la famille, d'un collègue de travail ou d'un ami. De plus, comme le démontre l'histoire touchante de Rose et Jacob, un arrêt cardiaque peut se produire soudainement, sans préavis, et peut affecter n'importe qui à n'importe quel âge. Les données récentes démontrent que malheureusement, lorsque un arrêt cardiaque se produit dans un lieu public, les passants administrent la RCR dans moins de la moitié des cas avant l'arrivée des services d'urgence. C'est pour cette raison que le taux de survie de victimes d'un arrêt cardiaque qui survient à l'extérieur du milieu hospitalier n'est que de 10%. L'objectif de notre campagne est donc d'éduquer la population et de la sensibiliser à l'importance de l'apprentissage des manœuvres de réanimation de base. Nous souhaitons fournir à la communauté les outils nécessaires à cet apprentissage. Nous croyons qu'avec ces outils en main, plus de gens se sentiront confiants d'intervenir face à une telle situation d'urgence, potentiellement sauvant la vie de quelqu'un. Ce nombre croissant d'interventions permettra éventuellement de diminuer le taux de mortalité chez les victimes d'arrêt cardiaque, non seulement ici dans la région de Montréal, mais dans tout le Canada aussi. So our live events broadcasted throughout the week of World Restart a Heart have in fact reached out to hundreds of people from all of North America and some around the world as well. So it's pretty incredible what we've been able to do this year. I'd like to show you guys a video that was made by our team at World Restart a Heart that describes the steps of what we call the chain of survival, which is essentially a series of steps that need to happen in order to increase the chances that someone is going to survive a sudden cardiac arrest.
In Canada alone, every 12 minutes, someone suffers from a cardiac arrest. If you don't do anything, they are going to die. In the next 60 seconds, we're going to teach you how to save a life.
If you see someone lying unconscious, the first thing you want to do is check if they're responsive. If they are not responsive and not breathing or breathing abnormally, they are likely suffering from a cardiac arrest.
Call 911, let them know that someone suffered from a cardiac arrest, send someone to find an AD if there's one nearby, and then start chest compressions.
For chest compressions, find the center of the chest, put your dominant hand down, interlock your fingers, and push hard and push fast.
Using an AED is really easy. You just apply the pads, turn on the machine, and follow the voice instruction. The machine will analyze the rhythm and tell you if a shock is recommended.
Thanks, Christina. For our audience, I think that video is great, and it tells you how to do CPR, and it works well for an adult. But there's differences between children and adults. Children aren't just little adults. Can you start to explain to us what some of those differences are between a pediatric cardiac arrest and one that might happen in an adult?
Yeah, so reasons for cardiac arrest in children do differ than from in adults. So in adults, most causes of sudden cardiac arrest are cardiac in nature, such as arrhythmias or heart attack. But if we compare this to children, reasons for cardiac arrest can be cardiac in nature, such as in Jacob's case, or they can be secondary to another event, such as choking or drowning. And in these cases, giving breaths during CPR is also very important because the cardiac arrest was caused by a lack of oxygen initially, whereas in a case that is more cardiac in nature, compressions only CPR could be just as effective as compressions and breaths. If you are CPR trained and you feel comfortable giving breaths, then this is always the recommended way to go. And that's where the importance comes in about taking an actual course. And the ratio of compressions to breaths is 30 compressions to 2 breaths in adults. And in kids, if you're alone, it's 30 to 2 if you're only one person. But if there's 2 or more people, then it becomes 15 compressions and 2 breaths. Il existe quelques différentes techniques lorsque vient le temps d'administrer la RCR aux enfants ainsi qu'aux bébés versus ce qui est fait au niveau de l'adulte. Idéalement, chez les adolescents et adultes, l'objectif est d'effectuer des compressions s'enfonçant environ à 5 cm de profondeur dans le milieu de la poitrine. Chez les jeunes enfants, l'objectif est de s'enfoncer jusqu'au tiers de l'épaisseur de la poitrine. Dans ces cas-là, moins de pression est nécessaire et il est possible que la profondeur idéale soit atteinte en utilisant une seule main. Enfin, chez les enfants âgés de moins d'1 an, assurez-vous tout d'abord de placer le bébé sur une surface plane. La RCR peut ensuite être effectuée en s'entourant la paroi thoracique de vos 2 mains et en utilisant vos 2 pouces afin d'effectuer des compressions au centre de la poitrine.
Merci beaucoup, Christina. Dr. Khalil, une question pour vous. Les défibrillateurs externes automatisés, les DIA ou AED en anglais, est-ce qu'ils sont dangereux pour les enfants?
Thank you, Farhan. Hi, everyone. It's a pleasure to be here. You know, more and more, I think people are learning about AEDs, the automatic external defibrillators ou les défibrillateurs externes automatiques. Il y en a de plus en plus. They're available in more and more places like arenas, like pools, like town halls and places like that. So I think Rose was making a very important point. And by the way, Rose, thank you very much for sharing that story. As physicians, we don't often get to hear the part that precedes. So that's much appreciated. But as you were saying, it is very important for them to be available. So the great thing is that more and more people know about them, know how to use them, and are becoming less afraid to use them. So they know that they can look for them. Some people may have attended some of the sessions earlier this week, the RAW sessions, where Dr. Deschamplain was talking about AEDs, and he was mentioning a free app called DEA Québec. And that helps you locate the nearest AED and tell you sort of the hours at which they're available because they're in a locked building or not. So that's a very interesting free app that you can download. I have it on my phone. So to answer your question, there are many differences between adult and pediatric CPR and resuscitation, as Christina was saying, and I won't repeat what you so perfectly described in terms of techniques, but oxygenation is an important part of resuscitation in children. So bystander CPR is very important, but the oxygenation portion may actually help to prevent the heart from stopping. So if that's possible, if there's a way to provide oxygenation before the heart stops, then that's a good thing. But there are situations where the actual cause of arrest, like in Jacob's case, is cardiac. And that's a situation where the AED will be life-saving. And so there was a lot of evolution in the AEDs when they first came out, but now what's become very clear is that AEDs can be used in all ages. Pour la définition des enfants, Christina, tu as mentionné un petit peu la différence entre des enfants. On considère des enfants jusqu'à l'âge de 8 ans, des nourrissons en bas de 1 an. So infants are under 1 year and children are up to 8 years. For all intents and purposes, above 8 years, you can use adult AEDs, you can use adult pads. But you should know that there are some AEDs that come with pediatric settings or pediatric pads that actually attenuate, so decrease a little bit the voltage that's delivered because the pads are smaller. The bottom line is, you're not going to know, maybe if you witness an arrest or a collapse of somebody, you're not going to know their age, you're not going to know their weight, you're not going to know, are they 1, are they 2, are they 2.5? Really, it doesn't matter. When the AED comes, you take out the pads and you follow the instructions and the way to place them, as long as the pads are, you're basically trying to put the heart between the pads. So if the chest is big enough that you can put one pad on the right side of the chest and one pad below, sort of on the bottom left side of the chest, so the heart is between those 2 pads, If the chest is small and you can't do that, the pads should never touch. If the chest is small and you can't do that, you put the one pad on the front of the chest and the other one on the back, so that again, the heart is sandwiched between the pads. That's really what you're looking for. And so no matter the size of the child, if you can do that, you can go ahead and use an AED, even if it's an adult AED on a child. Il n'y a pas de danger, ça peut être fait en toute sécurité.
Thank you very much. That's really helpful. I think it'd be interesting for our audience to understand, the cardiac arrests are really stressful for people when they happen outside of hospital. They're also a big event and raise the stress in the room in hospital settings as well, because it's a child and we really do care about that. Can you walk me through how the resuscitation team in the emergency department prepares and works through a cardiac arrest?
Yeah, I think it's, we were talking about, what should we discuss? And I thought that, like we all thought that this would be interesting for the public to hear, because I think it's a window into how we function, and it's important for people to understand. I'm very lucky. I work in a pediatric emergency room of the Montreal Children's Hospital, where teamwork is key. And especially around a resuscitation, that's when really the elements of teamwork are at their brightest and best. Je suis vraiment choyée d'être entourée d'une équipe de professionnels exceptionnels. All the emergency physicians are PALS certified. For those who don't know what PALS is, that's Pediatric Advanced Life Support. So it's like, there's basic life support and then there's the advanced course. And most of the physicians are in fact instructors. And some of the nurses are also, so RTs are instructors as well. The nurses are second to none, along with the ICU nurses. In fact, all the nurses at the Children's Hospital are fantastic. But the ones I know personally are in the Emerge. They are really amazing. Les INALO, les techniciens en radiologie, les membres de l'équipe psychosociale et j'en passe, sont tous à la fine pointe. Les coordonnateurs, eux, ils nous gardent coordonnés. Donc, vous voyez que chacun a son rôle à jouer et tout le monde sait qu'est-ce qu'ils ont à faire. On a derrière nous, au Children's, un répertoire complet de spécialistes et surspécialistes et de leurs équipes qui sont tous disponibles et prêts à répondre aux besoins de nos petits, de nos grands patients et de leurs familles. So, like I said, cardiopulmonary arrest is the ultimate test of teamwork. So what do we do? Like Farhan was saying, it's not something that happens necessarily every day, but it does happen. We have to be prepared for it, and we have to be expert at it. So how do we prepare? Well, we simulate, we practice until we're excellent at it. So we try to improve our communication, our coordination, our team dynamics, our leadership skills. We work on all of those things, and we always discuss the medicine behind it. And of course, we always debrief to learn, to improve our processes so that we're always better the next time it happens. Donc, comment ça se passe quand on attend un patient en arrêt cardio-respiratoire? Premièrement, on a un téléphone qui s'appelle le téléphone rouge, même s'il est orange, je ne sais pas pourquoi, on l'appelle le téléphone rouge. Il sonne et ça, c'est une ligne privilégiée avec Urgence Santé. Donc, c'est souvent le technicien de l'ambulance qui va nous appeler, qui est évidemment pas occupé à s'occuper du patient, mais qui va nous appeler pour nous donner un peu un préliminaire de ce qui s'est passé et ce qui s'en vient. Et ça, si c'est possible, il nous donne l'âge du patient et le poids si on le connaît. Cette information-là, pour nous, est vraiment clé parce que l'équipe s'active immédiatement. Donc, tout le monde, c'est des minutes précieuses, là. Si on peut avoir ces minutes-là pour se préparer et si on a les informations comme le poids, par exemple, du patient, eh bien là, les infirmières préparent les médicaments, les lignes intraveineuses. The respiratory therapists prepare all the equipment and machinery needed to support somebody's breathing. Les préposés bénéficiaires apportent, par exemple, le dossier, la planche dure pour qu'on puisse effectuer des manœuvres de réanimation de façon efficace. Alors, tout le monde a son travail à faire. Everybody knows what they have to do. We run around and do all that stuff, and then we pause and we stop and we have sort of like a huddle. And the purpose of that is so that everybody, we kind of review who are we expecting, what are we expecting the situation to be, and what is the expected plan of action, so that all the members of the team are calm as much as possible and prepared and are on the same page about where we're going and what we're doing in order to improve that coordination. So you see that it's a lot of coordination, but time and time again, I have seen this where it's all of this happens, and then when the patient arrives, it's like a well-oiled machine, right, in our response. So that's a little bit of a window into how it happens. When the patient actually arrives, le patient est transféré de l'équipe qui est en train de faire la réanimation à l'équipe recevante, c'est nous à l'urgence. Et la famille, en fait, on les encourage, je ne sais pas, Rose, I don't know what your experience was, but on les encourage à rentrer dans la salle s'ils le veulent, s'ils le désirent. Nous, on croit au bénéfice de ça, de la famille d'être là s'ils le veulent, toujours, parce qu'il y a certaines personnes qui préfèrent ne pas être là, et ça, c'est correct aussi. Donc, on a immédiatement une équipe de soins spirituels, des fois une travailleuse sociale, qui vont accompagner la famille, rester toujours avec la famille. Et il y a un membre de l'équipe médicale, habituellement, pas le médecin qui est en charge du cas, parce que lui est occupé, mais un autre médecin où il ou elle va faire la navette entre la réanimation et le patient et la famille, c'est-à-dire la famille, pour relayer les informations, donner des updates, talk about plans, and answer any questions. Because as Rose was saying, I completely understand what you were saying in terms of not being able to process. You hear the words, but you're not understanding them. And so questions come at times where you're finally able to process a certain piece of information. And so there's always that kind of back and forth with the medical team so that you can have an opportunity to answer those questions. And finally, you know, we've alerted the teams up on the ward, especially the ICU team, the intensive care team. So that would be Christina's and Dr. Banji's team. And we do a transfer. The team goes with the patient upstairs. And then we come back to our ER when the team gets back. And this is, you know, we're trained for this, but no matter how you slice it, when something like this happens, it's a very emotionally charged event for everybody, all the members of the team, and there's no way that anyone can just pick up the next chart and go see the next patient. We have a debrief, and so that's an opportunity for the team to sit down. It gives the space and the time for the team. Sometimes it's short, sometimes it takes longer, even when things have gone perfectly. We sit down and we just talk. We vent, we talk about what happened, and it gives an opportunity for people to regroup and to prepare to see the next patient. And that's about how it happens in the ER.
Thank you so much, Dr. Khalil. That's great insight for us to understand. I'm going to turn over to you, Christina. If you could perhaps walk the audience through what it's like once people, a cardiac arrest victim leaves the emergency department, so they've been resuscitated. What happens in that intensive care unit, and how is that approach to that care there?
So yeah, once the child is transferred to the pediatric ICU, they'll usually have a breathing tube that goes down their throat into the lungs, attached to a ventilator to help them breathe. And they'll be connected to a monitor that displays the child's vital signs and heart rhythm. And essentially, they're going to be monitored very, very closely by a very large team. The team will also monitor the child's neurological status really closely to be sure there hasn't been any brain damage from the cardiac arrest. They might also cool the child's body temperature by a few degrees for 1 or 2 days to help prevent brain injury. And the treating team will essentially investigate possible reasons for the cardiac arrest in order to be able to treat it. And then treatment could be a few different things. And a whole multidisciplinary team is involved in the child's care at the pediatric ICU. We have nurses, physicians, respiratory therapists, nutritionists, pharmacists, physiotherapists, specialists from neurology and cardiology, as well as social workers and spiritual care workers for members of the family as well. And so usually by the time they leave, we don't really see what happens to them, but I would imagine there's an extensive follow-up as well. And I'm sure Rose has a good story for that.
Yeah, that's incredible to hear. And, you know, I think probably the second biggest joy to seeing children recover in my work, and I used to work in the emerge and still work in the critical care, is the ability of the team to work together and come together for the good of children and their families. And I think we are so fortunate to have such incredible nurses, respiratory therapists, hospital services, social work. No matter who we ask to step in and do more work, If it's to help a family, everybody gets in. And that culture of the children is absolutely incredible. Probably the best thing about working in that environment is we all understand what it means to set up a child. I'm going to stop here and ask people if they have questions for us, if they'd like to bring up comments, if they'd like to have anything discussed for us as or for the panelists to bring in. So maybe while we're waiting for some questions, I can make a comment that's just a remark, and it's really interesting. Cardiac arrest, as we know what to do with CPR, as we know what to do with teams, we're starting to understand that. But one of the things that we really don't understand is the impact of cardiac arrest on somebody, and how it affects different people in different ways. Family members that experience that cardiac arrest of somebody within their family, some are open and able to speak, others are more quiet. Some are able to speak about their own cardiac arrest, and it empowers them to make a difference. Others move away and are less involved in it. Bystanders feel that stress, and almost like a post-traumatic stress. And there are researchers in Toronto trying to bring groups together to think about that. I'll turn to our panelists and see if they have anything to add to that, and for their sense. And that is a big area for future research that I anticipate.
Oh, sorry, go ahead.
No, go ahead.
Start with Rose and then go to Dr.
Well, first, I just want to say that after Dr. Khalil explained everything, and so did Christina, of what actually happens, it really, I can attest to, it really does happen that way. It's such an incredible orchestra that happens. Like I saw it actually happening, and the doctors and the nurse, like I've just never been around such incredible people. Like there are no words in my vocabulary to express how grateful I am. People complain about medical system, yada yada sometimes, but hands down, if you need, it's all time. Like really at the children's. I've never seen anything like that. But for sure, there was a lot after Jacob's cardiac arrest. A lot of people needed to talk. A lot of the people that witnessed it on the team needed to talk about it. Like it was all people were talking about. It's like everybody needed that therapy to just kind of talk about, because it's almost like, the only way I can describe it is, when you watch a movie and you see different perspectives in the movie, so everybody had a different perspective of what happened that night. Everybody's life that night was seen from a different lens, and everybody needed to just like talk about it, talk about what happened. And then at some point, at least for like my husband and stuff, it became kind of like I don't really want to talk about this anymore, right? And definitely for Jacob, the one who had the cardiac arrest, for him too, but also I think partly because he doesn't remember any of it. Like he has no memory. He doesn't remember getting on the ice to play the game. He just remembers being in the dressing room, and he doesn't remember anything until about maybe 30 hours after he was extubated. He has no memory. So we're telling him stuff and he's just like, okay, if you say so, but I feel okay. And right, he doesn't remember. So he doesn't like to talk about it as much. Whereas, I'd rather let people know kind of, what it was and how important the CPR and the AEDs are, and just, yeah, it's very traumatic.
Thank you for sharing that. Dr. Khalil, did you want to add anything to that?
I think it's basically just segues perfectly from what you just said, Rose, is that I think the more we talk about it, the more it becomes destigmatized. And I know that's one of the main kind of purposes of RAW, right, is to raise awareness by just having people talk about it. And for me, it's so powerful to hear the story of Jacob, you know, and having you speak about it so openly and freely. I think that there's nothing more powerful than that, to encourage people around just to even inquire, like, what is an AED, to maybe open it one day or ask somebody or look it up on the internet, and just the idea that just that one thing, or getting the training or learning how to do CPR, might save a life. That's incredible. Just talking about it might do that. So that's all I was going to add. Yeah. Thank you so much.
I understand that there's some questions within the question segment. I can't see them right now from the chat. So I'm just going to turn to our organizers to see if they can just read out a question or two from the question box.
Sure, thank you. This is Valerie. I'm just going to pull up the.
Thanks, Valerie.
Yeah, I'm going to just see. How come it's not?
This is
okay, so we have, sorry, thank you. One comment, just thanking Rose, thank you everyone, especially Rose, for having the courage to share her story. It must bring back a lot of memories and emotions, so thank you. Then the next question is, does the coronavirus pandemic affect the way bystanders should resuscitate? That's a very timely question.
Well, I'm not sure, Christina, do you want to take that one, or do you want me to pass that to Dr. Khalil?
I can speak, and then if there's anything missing, maybe Dr. Khalil can fill in. So essentially, the technique, everything remains the same. As we mentioned, most of the cases that occur out of hospital are with a significant other, a family friend, a colleague. So if you feel comfortable giving mouth to mouth, and you know that they're, you know, it's not a stranger, then that still goes. The only difference, if you were outside and you came across a stranger who had a sudden cardiac arrest, you would cover their mouth with a cloth. So if they have a mask, or if you see like a sweater or anything, then you can just cover their mouth. And if you have a mask as well, to put that on and give compression only CPR like you would any other time. I'm not sure if I'm missing anything else.
So the principles are the same. It is, you can do the regular CPR, but if you're nervous about it at all, don't stop yourself from acting, and do compression only CPR. And that's a good message for kids, for people that you don't know. It can save a life. The power to save a life is in your hands.
Thank you very much.
I was just going to add that there are lots of studies that have been done on procedures that actually generate particles that increase the risk of catching COVID and catching the coronavirus. And compression is not one of them. Compressions is not one of them. So by putting a mask on yourself and on the patient, and if you don't have a mask, any cloth or t-shirt on the patient's over their nose and mouth should protect you perfectly. So, yeah.
Valerie, did you have another question?
Yeah, there are a few actually. One person would like to know, on a normal night, is your department always busy? I assume they're talking about the ER. What is a normal average number of patients, as an example? Thank you.
Normal number. There's no normal. That's the fun of the ERs. It's unpredictable. You know what I'm going to say is that I think what is interesting is we are always very busy. We're an extremely busy emergency room. What happened during the pandemic, and this was seen worldwide, is consultations to the emergency rooms decreased. And as emergency room practitioners, we got worried because the kids that we would see with, for example, new onset of diabetes or severe asthma, things that are unrelated to COVID, suddenly weren't appearing. So we were actually very worried about those patients. And the same thing was happening on the adult side. What we're seeing is now an increase in the numbers. I think people were just afraid to come. So I guess my message would be, if your child is sick, you need to use an emergency room, don't be scared to come to the emergency room. We have all the appropriate precautions to protect the families, to protect the staff, to protect your child from COVID. So if you think your child needs emergency care, you should come, no matter how busy or not busy it looks. That's the message. I know I'm not answering in terms of numbers, but that's, because they're so fluctuant and unpredictable that they really don't mean anything. One day could be crazy busy. I worked last night and it was pretty busy. I mean, quite busy. The night before that, we were sitting around chatting. So it's unpredictable.
Thank you. The next is a nice comment. Thanks, really helpful. Et merci pour la présentation bilingue and for the different point of view around this particular event. C'est un privilège d'assister à une présentation comme celle-ci. Donc, merci beaucoup pour ce commentaire. Somebody asked where they can see the video again. They really liked it. So,
Christina, would you like to point people to the site?
Will we be putting this on the McGill World Restart a Heart page? Okay,
No,
I wasn't sure.
I think they were perhaps asking about the video for CPR. And that's
did they mean
yes.
video?
Yeah, the video for CPR, yes.
Oh, okay, yes. So it's actually on our website, which is www.mcgill.ca/WRAH for World Restart a Heart. And all of the videos are on there, as well as all the information about our team, our mission, and all of our projects.
And please take a moment to not only watch that video, but there's 2 other amazing videos that are worthwhile to watch. It may be 5 of the most important minutes that you spend this year. So I think that's really important. It's now time. So Valerie, with your permission, perhaps what we can do is take the questions and then figure out a way to answer them afterwards. But I did want to take
perfect. Maybe I'll try to just summarize what I see, because there's a question about how often does the staff get retrained in CPR, and is it everyone, like social workers, or is it just the ER and ICU staff? What percentage of cardiac arrest in children or teenagers is due to undiagnosed congenital heart abnormalities? And are there signs to watch out for? And do gym teachers get CPR training as part of their certification? And can an AED be used safely if someone is on a metal bench or a bleacher? So I guess we're thinking in a sports scenario. How prevalent is pediatric cardiac arrest? How many cases would the hospital see, I guess, in a given year? Is it as common as it is amongst adults? If you're alone, should you do compressions or use your app to find the closest AED? And then a couple of messages of thank you. So
those are great questions. Unfortunately, that would run us well past our time. We're already past time, but perhaps we can take those questions, Valerie, if you're okay with it, and then we can find a way to provide the answers to people, because I think that would be really helpful, and we want to be there for you. I think
I think we could save them and note the people who asked them, and then we could maybe answer them offline.
Perfect. And if we can just take 30 seconds to wrap up, what I'd like to do is thank our panelists, because I think without them, this story is not worth telling, and particularly Rose and Jacob to share their story and help us understand things. We do want you to encourage your friends and your colleagues to learn about CPR. So please, please, please go visit the McGill website, visit the foundation page, the McGill World Restart a Heart. It'll give you some useful resources. It'll give you what you need. Take in your mind that if somebody has a cardiac arrest, you can't do any harm. You need to act in that moment. You need to overcome the fear. You need to overcome the panic. You can double or triple their chance of survival by acting in those moments. That's a key take-home message. We talked about what our healthcare system does. The ICU, the emerge, we do all of that. And the difference we make, we might change survival by a little tiny bit. You have the ability to double or triple that survival just by knowing what to do. It doesn't have to be perfect. You just have to act at the right moment in time. And so that's what we want to feed to all of you. We want your help to get this message out there. It is a critical public health issue, and it happens to children, it happens to adults. Knowing this is a life skill that we want to do. So thank you all for being here, and thank you to the foundation for putting this on. We really do appreciate the opportunity to tell the story about this. So thanks, everyone. and be safe. Talk to you soon.
Thank you.
Thank you.
Thank you very much.